Now, the country remains at a standstill under the red setting, but of course, as we head on into the future, we're going to have to learn to live a new normal with COVID. And to join us now to discuss some new measures that are going to be introduced, I'm joined by Director General of Health, Dr. Ashley Bloomfield. Dr. Bloomfield, thank you very much for being with us this morning. I know a couple of weeks ago, good morning, you were speaking with ministers about a fourth jab, or I guess a second booster. Where are you at in terms of giving advice to the government on that?
Yes, well, I've had advice from our vaccination technical advisory group, and we're just in the process of turning that into advice for ministers, and they'll be considering that, I'd imagine, later this week. Certainly, there's a lot of interest in this area, but not a lot of evidence from around the globe. So we've been wanting to make sure we collect all the latest evidence and, of course, look and see what other countries are doing, including Australia, which just made a call on this a couple of weeks ago. So that's been very helpful for our advice.
If it was to be introduced, are you looking at a whole population or are you looking at vulnerable communities?
Well, from a whole population perspective, the most important thing at the moment is that we get our third dose, our booster rates up as high as possible. At the moment, only about 75%, and we would like that to keep climbing. So that's going to be a very important part of us keeping our vulnerable populations protected. In terms of that possible fourth dose, if we look at other countries and where the evidence is, it seems it's most important and most useful in those really vulnerable populations, so older people and people who are immunocompromised, perhaps because they're having cancer treatment or they've got another pre-existing illness. That's where most countries have gone, and that's certainly where, if there is any evidence, it's strongest.
Okay. Now, we are looking now at medicines that are being used to treat COVID, and I know there have been some available in hospitals already. But this week, it's a Pfizer pill, isn't it? Paxlovid, which is, am I right, the first pill that people would actually be able to take at home to ease symptoms?
Yes, you're correct. And I mean, this is a very exciting development to have access not just to what appears to be a very effective antiviral. Most antiviral tablets are not very effective, but this one is. But also we've managed to get it here, and from today, it's out in pharmacies, and from today it will be able to start being prescribed. It's for a very small group of people. It's people who are particularly at high risk of being hospitalised. They don't need to be hospitalised as yet. They don't need oxygen, and if they start this oral medication within 5 days of their infection, then it really greatly reduces the likelihood they will get seriously ill or be hospitalised. So it's an excellent development to have this now available out in our communities.
Okay, so if you're somebody at home who's struggling with COVID, perhaps it's particularly affected you, are you able to go to your GP and say, I want this pill, or is it going to only be prescribed to people who, say, asthmatic or have immunocompromised issues?
Yes, so it's quite a narrow set of criteria to ensure it's given to those who will benefit from it.
Is that just because we have limited supplies?
It's mostly because these are the people who the studies show it benefits, because the whole purpose of the tablet is not just to reduce symptoms in people who are otherwise well. It is to prevent people who otherwise are at high risk of being hospitalised from getting really unwell and ending up in hospital. So the criteria are narrow. They're on the Pharmac website, and of course all our prescribers will actually have a good idea who the people are, for example, in their general practice, who would fit into the category for being eligible for this medication.
We're hearing a wee bit about a new variant, XE. I know these variants come along quite often. It's always evolving. This one seems relatively concerning because it's 10% more transmissible than Omicron. Is it something we need to be worried about?
Well, it's certainly something we need to keep a watching brief on, and one of the things about XE to explain is it's actually a combination of the two Omicron subvariants, the BA1 and BA2 subvariants. So these viruses are constantly exchanging genetic material. So the XE variant seems to be maybe about 10% more infectious than this BA2 variant that we've got quite widespread across the country at the moment. We haven't yet seen it here in New Zealand. It's been found in a number of countries in Europe, but relatively small numbers of it so far. We'll be watching it closely.
If it did come to New Zealand, would that significantly change the advice around the traffic light settings?
Well, we would have to see, really. At the moment, what we would want to look at is, for this variant, but also any new variants, really, what are the characteristics of it that would mean we'd have to use some of the other measures we've used in the past, and that includes some of the traffic light measures around stricter indoor limits. Of course, we're retaining the use of masks, and I can't emphasise how important that is, not just for Omicron, but for those other winter illnesses that we know will start to come across the border. So we would look at the characteristics of this variant and then look and see what are our measures we currently have in place, and are they sufficient to sort of try and keep the numbers of it down at a level we can manage.
Dr. Bloomfield, at the weekend, I'm not sure if you were able to catch it, but on The Nation here on 3, they spoke with the US President's Chief Medical Advisor, Dr. Anthony Fauci, who is, I guess, your equivalent in the US. And one of the things he said was that he wanted science to move away from politics. And I'm quoting him here now. He says, "We're seeing divisiveness very intensively in the US, and unfortunately this does interfere with an optimal response to the outbreak." Are we seeing the same here, where science and politics have been too intertwined, and has that affected your work?
Actually, I think one of the reasons New Zealand has done incredibly well right through the pandemic so far is because we have had politicians right across the political spectrum have listened to the science and have been prepared to take advice that is science-based. Of course, ultimately, it is politicians who make the decisions, and our advice, including the science basis for our advice, is just one input into those decisions. They're the ones who have to make those decisions. I think New Zealand's managed to get the right balance between having a very strong focus on science, but ensuring that it's the politicians that ultimately make those decisions. It's much more of an acute issue, perhaps in the USA and some other countries.
Have you ever felt like a decision has been made for a political reason as opposed to a scientific reason?
Oh, well, I don't ever try and second-guess the decisions that ministers and that governments make. And I've been a public servant for over 25 years now. The key thing is my job is to give the best advice I can, and I'm really pleased with the advice we have been given and the fact that that has greatly influenced the New Zealand response to the pandemic, and I think it's served us all very well.
Thank you so much for your time, for being with us this morning, Director General of Health, Dr. Ashley Bloomfield.